What is type 1 diabetes? Diabetes is a condition in which the glucose level in the body is too high. Over time, this results in serious health problems like heart disease, kidney failure, or blindness. There are different types of diabetes, such as type 1, type 2, and gestational diabetes. In type 1 diabetes, the insulin-producing cells in the pancreas are destroyed. This is usually due to an autoimmune process. Insulin is a hormone that acts as a key to allow glucose into the cells. With no insulin, glucose cannot enter the cells and stays in the bloodstream. What is the difference between type 1 and type 2 diabetes? Cause. In type 1 diabetes, the body does not make insulin, whereas in type 2 diabetes, there is resistance to the action of insulin. Onset of symptoms. In type 1 diabetes, the loss of insulin-producing cells occurs over days to weeks. This quickly leads to high glucose levels, a buildup of blood acid levels, leading to an acute presentation with diabetic ketoacidosis, or DKA. In contrast, many with type 2 diabetes may not know they have it, since there may be no symptoms for years. Risk factors. Insulin resistance in type 2 diabetes is usually related to being overweight or obese, while type 1 diabetes does not occur in relation to weight status, lifestyle, or food choices. Currently, there is no way to prevent the onset of type 1 diabetes. Treatment. Individuals with type 1 diabetes require lifelong insulin replacement to sustain life. Most people with type 2 diabetes will not require insulin and may control their glucose levels using oral medications. Possibility of prevention or remission. It is not possible to prevent or reverse type 1 diabetes. In type 2 diabetes, lifestyle changes and weight loss alone can lead to improved glucose control and even remission. Click here to watch the next video, Replacing Insulin, What Matters, and click here to watch the rest of the videos in our type 1 diabetes animation series.